So, I'll just start by introducing this. I'll turn my camera off if that's okay. I'll start with the introduction of the course itself, this unit. So if I can share this, the unit aims basically. So, yeah. Share sound also. Okay. So what we tend to teach in this unit, please let me know if my slide is visible to you. Can
Yes,
you
it
see?
is
Yeah.
visible. I
Okay,
can
great.
see. Yeah.
That's great. Yeah, thank you. So, and anytime you can't hear my voice, please, you have the chat box on Zoom. You can always let me know that if my voice is breaking or anything else. If you want support, please let me know. Yeah, so the aim here is to support individuals in adult social care. Now, we would want to know what an adult social care is actually. We'll go about in today's learning objectives. So this unit specifically would aim to support developing your skills and your knowledge that is required to support individuals. So you're in the right place. So if you want to support adults in an adult social care, because every social care is different. So adults will be completely different compared to children. So you would be looking at practical aspects of adult care and how these would contribute to health and well-being of service users. It's a unit. Uh, it's a level 4. What HE level 4, and it's got 15 credits. So there's when you're doing your assignments, there's a pass, merit, and a distinction. So you would have certain learning outcomes that you would achieve during these sessions. So your first learning outcome would, for instance, make you understand communication in adult social care. And there are different criteria for passing this, just passing this, or if you want a merit. Um, there's no distinction in this. The second learning objective that we will cover is understanding person-centered and personalized care, which is being advocated a lot now, even more than before, because it's the social care that you're giving, but it should be personalized and tailored according to the person themselves. Then we would go on to understand safe practice in adult social care. What are the safe practices? How would you manage risk in adult social care? Analyze safe practices in adult social care. So we'll talk about this in detail. I'm just giving you a bit of hints so that you know where you have to focus on when you're studying this unit, and also when you're doing your assignments. So the assignment discussion will be at the end of these 4 learning objectives that we will cover. The 4th learning objective will be to understand professional practice in adult social care. So this is what we look for in you. It's a lot that we see here, but basically we want to see methods of effective communication. So what are the different levels of communication that we'll talk about in adult social care? When to use different methods, which is best for which person. So if there's a person with a hearing disability, you would not want to go for just a verbal conversation, and that too on a telephone, for instance. Importance of communication in health and social care. Why is it important? Reasons for communicating. Factors that affect communication. So there are different factors. We know that the environment, the emotional state, subject under discussion, all of these impact social care or communication, sorry. What are the barriers to communication? So in that environment, if you cannot, it cannot exist without barriers. So they're physical, perceptual, they're emotional, cultural, language, gender, interpersonal. Many more also, but the main headings are this way. How to overcome these barriers? Impact of poor communication on staff. So you could have poor communication between yourselves also, and how would that impact you? Using positive communication skills in adult social care. Use of assistive technology, which is very helpful now. Use of interpreters and translators to have better communication, visual communication, You need to advocate for support your communication, legal requirement for advocates, what advocates are and what they do. Communication skills, we'll talk about what skills they are, what are required. Principles of effective communication, then we will talk about them. Some more. So effectiveness of communication, adjusting communication to meet what the needs are. In confidentiality and risks to confidentiality, particularly in adults, is very important. Consent, lack of consent, capacity, do they have the capacity to give you their consent, is also very important. Requirements for record keeping and reporting, it is very important. For every instance, you have to have a record. Importance of record keeping and what are the consequences when you don't comply to them. Use of records and reports to support decision making. Best practices and use of technology for records and reports. So, and then we talk about understanding what personalized care is. You can have a look at all of this because this is there on Moodle. I've just given you a bit of hints and what you have to look basically while following your objectives for your session, for your assessments would be these four. So understanding communication, understanding person-centered and personalized care, understanding safe practice in adult social care, and understanding professional practice in adult social care. I hope that's clear. If it's not, it will get clearer once we delve into it. So this is just in a nutshell because I'm particularly I am conscious of the time that we have to start. Okay, so yeah, any questions, please let me know in between. Now we start our session. So I hope you can see it, my slides.
Yes, I can see it.
Okay, great. So how the first learning objective, as I mentioned, was understanding communication and adult social care. So if you would want to go and talk about what this unit aims, it aims to support development of skills and knowledge that is required to support individuals in social care. So you will look at practical aspects of adult social care and how these would contribute to the health and well-being of your service users who are adult in age. So what this would say, if we consider what the indicative content is, we've talked about this, about communication. That is why I went into a bit of more detail. So this is your learning objective 1. We've talked about what we'll cover in the communication. This is just a repetition of it. Again, this is the same again. So a bit about key terminologies. What do you think is an adult? What age would you say is an adult if I ask you? It's written over here, but if I ask you, what would you say?
Well, I would say adult is somebody that is, with my own description, maybe somebody that above 50.
Okay.
Yes, it's an elderly adult. Though from what is written here, it said from 18. So, but I know adults is somebody that is above 50, maybe.
Yeah. So that's, yeah. And we're talking about adult social care right now. So it's, the age is roughly between 19 to 64 years. This is according to the NHS. And social care. So what do we mean by social care? Obviously, it's delivered by a wide range of organizations. You have the NHS, you have other organizations working together with the NHS or separately, and they work within families and communities. So more people work in adult social care than you would think. Let's talk about more in detail. Let's watch a video. Just a minute. I'll start sharing my screen for the video. So if I stop sharing my screen and okay. Please let me know if you can see my screen.
Yeah, I can see it.
Thank you. So, just taking some time to scroll.
Yeah.
Can you hear this as well?
Social care.
Sorry. It's a bit busy right now. I'll just get it from the start. It's a bit busy right now. Minute. Yeah, I think now it's doing its work.
Social care has been in the news a lot recently. But what exactly do we mean when we talk about social care? It certainly doesn't have the recognisable brand that the NHS does. Part of the reason that it's so hard to define is that social care covers a huge range of activities, from child protection to end-of-life care. Today we're going to talk about adult social care, providing help, care and protection from harm for adults with physical disabilities, learning disabilities or physical and mental illnesses. At its most basic, this can include help with washing, dressing, getting in and out of bed in the morning, help taking medicine and help with the housework. Social care is becoming more and more important as our population gets older. The number of over 85s in England has gone up by over a third in the last 10 years and will more than double in the next 20. Local government has the main responsibility when it comes to publicly funded social care. So, what do councils do? They provide information and advice, they assess and monitor your needs and finances, they provide short-term support called reablement, they safeguard vulnerable adults from abuse and neglect, and they buy and monitor care from a large range of organisations. With more people living into older age, this means there'll be more frail people and more people living with long-term illnesses. In turn, this means that there'll be more people with needs for care and support. The number of people receiving formal care from the state has actually reduced over the past 6 years, despite this increasing need. Our research shows that the social care system as it stands is struggling to meet the needs of older and disabled people.
Okay, that's about it. That's clear. I'll just start sharing my screen again. Just a minute. Yeah. Okay, coming back to the presentation. Okay, here we go. You see my screen now again?
Yeah.
Yeah, great. So we saw that video, quite informative, that there's more required for elderly social care, especially. So the first objective that we would talk about to break the objective is to analyze the importance of effective communication and how this can be applied in practice to meet needs of service users. So obviously we know that when there's not effective communication, it makes the message a little murky and you're not really aware of what is being delivered, what is there, what is being said to you. You need to know what are the bullet points in a communication. So the communication can be short, it can be long, but what are the main important things that need to be there in effective communication? So there should be facilitation in communication. So you would have effective communication would ensure that you're basically whatever you're communicating, it's accurate and comprehensive. And it would have mutual understanding between you and the service users. And you need to be very clear without using any jargons, and what their preferences are, those have to be uh, looked for while you're communicating with someone. Building trust and rapport, so clear and empathetic communication would foster, it would strengthen trust and rapport between service users and care providers. Trust is essential for service users, and this is to feel comfortable expressing their needs and concerns, which will in turn enable care providers to tailor their support accordingly. And then there's empowerment and involvement. So when you are into effective communication, you would empower the other individual by asking their preferences, and then this would, you promoting autonomy to them and self-determination of their this means that they would determine what time would be best for them for a particular activity, for instance. So there's some things that have to be rigid. For instance, if they're taking their medication, that has to be done when it has to be done. But sometimes you could be flexible in considering their involvement in what they need, in what they think they need best. So, and considering if they have capacity for it also. Identifying and addressing barriers. So there are different barriers to communication. We talked about cultural, language barriers, physical. How would you understand? How would the other person understand if you're using certain terminologies? That barrier is always there. So we use lots of jargons. We, as healthcare workers, are used to it, but those should be avoided as much as possible. And whatever barriers they are, those need to be addressed. And then enhancing quality of care. So with whatever care you are giving, whether small, whether large, that has to be enhanced. So this is when you would meet the quality standards. Then there's some practical applications in meeting the needs of service users. So sometimes you need to tailor your communication methods. As I said, there's someone who has a hearing problem. You would probably ask for a hearing aid for that person. Or for instance, you would use certain other British sign language, for instance, in order to communicate with them. It depends how much they require it. So you'll sometimes have to tailor your communication methods. And active listening and empathy, always listen. Always be empathetic with the person, because that is the cornerstone of our services, and that particularly is very important when you're dealing with older age group or very younger age groups. Respecting their confidentiality and privacy. So if they are saying something to you that is relating to safeguarding or some other concerns, you need to keep it confidential and safe and private as much as possible. Seeking feedback and clarification. So you should ask them for feedback. So for instance, if I'm teaching you this session, and at the end I would want to know what you learned from it. You could always ask for feedback and ask, like, at the end of your conversation, just give a general summary of your conversation and ask them if they understood what you said and if there's anything that needs to be added. Cultural competency. So there might be people who have certain other cultures, they have different norms, they have different beliefs. Those should be respected at all time. Yeah. So in conclusion, effective communication would always be there for meeting the diverse needs of service users in adult social care settings. And this is when you recognize its importance and implement practical strategies, you can enhance this care to the best of your ability. I hope this is clear. Any questions from here?
No, I'm okay.
Okay, so the next part is assessing the requirements for record keeping. As I said, records are very important. They need to be there in your files and cabinets, and they need to be safe there. It is very important to have record keeping that should be updated regularly. So there's a legal framework. So adult social care, it's governed by various legal frameworks and regulations that these mandate record keeping and reporting practices. In the UK, you have the Health and Social Care Act 2008, regulations in 2014, that sets out requirements for record keeping and reporting in social care settings. Then you have organizational policies and procedures, where you have adult social care providers who are required to establish and adhere to internal policies and procedures regarding record keeping and reporting. These should align with legal requirements, and they would outline specific processes for documenting care, interventions, incidents, and service user information. Now about further about record keeping, and I think this is the same slide. Okay, so yeah. So what are the types of record keeping? So you have care plans, where you have comprehensive care plans that are essential for documenting what the service uses. So you'll have probably 5 people who are under your care. So their care plans need to be documented and reported. And any changes in their medication, for instance, should have medication administration record. So you will call it MAR. This should be included, including all the details. You have the medication name there, the dosage there, how many times would you administer there, and any relevant observations or interventions. Their incident reports, so that's an incident happening, an injury happening, or safeguarding concern, you need to have those reports there also. And then progress notes are very important concerning their health and their situation, obviously. So what are your requirements within this? You need to be accurate and complete. So if you have a checklist of these documents, it helps a lot to make you sure that you've completed the checklist. It helps you in your accuracy and completeness. They have to be timely, because if they're not timely, then there's no use giving a drug, giving an intervention, and it's not being given at the right time. And the right, obviously doses change. So, and your record keeping also should be timely. So whatever you're doing, everything has to be in a timely fashion and confidential and data protected. So you have the GDPR regulations. Please go through these. They've been uploaded on to your Moodle webpage also. Just have a look at them, because this is what you will be dealing with a lot when you're into adult social care. And obviously, there'll be people who will want to know about their adult loved ones, but then you have to know whether you have the authority. How much do you want to share, or how much are you allowed to share with them? Communication and collaboration is very important, and we mean not just with service users, but it's also interdisciplinary communication with other disciplines also, which helps a lot. Training and competency. So you are provided training. So this is one type of training that we are providing you. And when they're care providers, as care providers, you should receive adequate training and education on record keeping and reporting practices. This will be part of your professional development. Their training programs that should cover legal requirements, documentation care, and the use of electronic record keeping systems. For how long do you have to have them? In how much time do you have to discard them? So that, because there's a lot more that you have on your plate. So how do you make sure that this is done, and then you are okay discarding this information and then storing new information as required? Competency in record keeping is very important. This would ensure that the care providers maintain proficiency in their essential skills. In conclusion, so there's record keeping. It's very important, just so that it's transparent, and whatever you are providing, whatever care that you're providing is meeting the needs of the person themselves. I hope that's clear.
Yeah.
Yeah, thank you. So Now we would want to evaluate the application of best interest in cases when service users are unable to provide consent. What happens? So there's a care user who does not want a surgery, for instance. What would you do? What would be your option to go for? And that surgery is life-saving. What would you do?
I would try to encourage the service user to tell the service user the importance of doing the thing and the side effect of not doing it.
So
Then
if there's a, yeah.
I would try to encourage the service user that it is in the best interest of him to do it.
Yes, exactly. So this is the way you have to do it. So for instance, if you pursue it, that this is the this is what is best for you. This is the first point that you would go for, and then if you could have a contact with your medical legal department, for instance, that would really be helpful. In this case, obviously, your medical legal team would get in touch with them and family members and what is their interest. So you are giving care that is tailored to their needs, but then you would also want to do something that is best for them. So ethical considerations should be there. So there should be autonomy and respect for persons while their best interests are taken care of. People who lack capacity, obviously you will have to determine if there's capacity or not. Then their ethical, you will, once you've determined that, their values and wishes, you've seen them, you've considered them. There are some then ethical decisions that would align with the person's own preferences, but then they should all be in their own beneficence. Beneficence and non-maleficence is very important in ethics. So you would provide benefit to them, which is in their best interest, but and avoid any harm that is non-maleficence. Legislation is very important. It's legal framework such as Mental Care Capacity Act, UK, that provides guidance on decision making for individuals who lack capacity. So according to this, decisions are made on behalf of individuals who lack capacity. They must be made, all decisions must be made in their best interests. They take into account their past and present wishes, beliefs. So they might have some beliefs that are not aligning with your beliefs, but then you have to take care of them. There are certain court decisions that you would have to take into consideration. Some precedents that play a significant role in how best interests are determined. So you don't know what is the best interest for this person. So you would want to seek advice from others also for this. And then practical considerations that would also consider multidisciplinary approaches. So when you evaluate best interests, often they require input from a range of professionals, which includes social workers, healthcare providers, family members, and other relevant stakeholders. Collaborative decision-making ensures that diverse perspectives are considered and helps to minimize the risk of overlooking important factors. And then documentation and record keeping is very important. So you need to have records of these documents. At the end, you would evaluate. So once there is a decision made, it is essential to consider whether the decisions were made in accordance with legal and ethical principles, whether the service users, their own wishes, values, and preferences were considered appropriately. Were the risks and benefits weighed carefully, and were the interventions appropriate and proportionate, and include them or not in the decision, and were they? Conclusion: overall effectiveness of best applying interests of applying best interests in cases where service users are unable to consent depends upon various things, which we've talked about earlier. You would have legal and ethical standards there, continuous reflection, evaluation, and improvement of decision-making processes are very important to ensure that best interest decisions genuinely have been served. These are some of the references if you would want to go through them. And yeah, that's about it from my side. I'll recording the session. Yeah, any sessions will be so I'll be happy to take those questions. I do always while you submit your assignment, you now do your assignment about what is required from you, and also use of AI, which we stress a lot upon this, that AI, artificial intelligence, should be discouraged as much as possible. So that from my side, we'll see you on Monday. See yourself.
Yes.
Okay.
Yeah.
Good luck. Yeah.
Thank you.
Take care.
Thank you. Okay.
Bye.
Bye.